one was the panel discussion on the chronic pain management and guideline development in Ukraine. And we will invite KATERYNA KOVALENKO, who will be a moderator from Nova Ukraine, OKSANA from Nova Ukraine, ANDRII STROKAN from Feofania Hospital, Ukraine, Roman SMOLYNETS from Lviv First Medical Union, and DMYTRIIEV from Vinnitsa National Medical University. Welcome, and thank you for coming all the way from Ukraine for this.
Two people online. Олександр Шеметун and DMYTRO. Yeah, do you have it? Huh? Super. So good afternoon to everybody. So we continue with the topic of pain management, and I feel privileged to moderate this panel and to share our experience from Nova Ukraine and partnership and our partners in Ukraine and here in US about the project Ukraine Without Pain. And I feel honored to introduce our speakers today. We will have Олександр Шеметун, who will replace OKSANA GOLOGORSKAYA. And I think that Олександр should be here. Олександр, привіт, do you hear us?
Так.
Perfect. And we have in the room with us Dr. ANDRII STROKAN from Feofania Hospital, Ukraine. ANDRII. We have with us Dr. Roman SMOLYNETS, First Lviv Medical Union from Ukraine. Roman, welcome. And we have with us also Dr. DMYTRIIEV, Vinnitsa National Medical University from Ukraine. And yes, we see you. Do you hear us?
The Chief Ukrainian Society student.
Perfect. So I think we are ready. We have 50 minutes for our panel discussion, and a very short overview from my side, just to give you the whole perspective, what the project Ukraine Without Pain means, and then we will try to unpack every aspect of this project together with our esteemed speakers. So this panel discussion will explore the critical advancements in pain management during wartime, focusing on Ukraine's innovative approaches to acute and chronic pain care amidst the ongoing war. Drawing the expertise of leading Ukrainian and American specialists, this panel will examine the prevalence of severe chronic pain, novel treatment methods, and systematic development of national plan management standards. We would like to emphasize collaborative efforts between Ukrainian institutions, Nova Ukraine, and international partners, including joint research initiatives and training program. So our esteemed speakers will share today insights and their incredible experience in creation of specialized pain management centers, and Олександр Шеметун will tell more about that. We will talk about innovations in pain management during wartime, collaborative development of national pain care standards, role of AI, and minimally invasive techniques in trauma pain management, and lessons learned from all of our speakers. You will gain a comprehensive understanding of how Ukraine is addressing the complex challenge of pain management during wartime and the role of international partnerships in capacity building. Pain management, as we yesterday talked about that a bit, it's a complex it's not only a medical issue, it's a complex issue that requires coordination between government, hospitals, international partners, research institutes. So Ukraine Without Pain became real due to continuous and very close collaboration between Ministry of Healthcare of Ukraine, Doctors United for Ukraine, Yale Medical School, Nova Ukraine, Feofania, Vinnitsa Medical University Northwest, and Harvard, who provide the online course. And this project was founded by Nova Ukraine, Yale World Partnership Fund, and Doctors United for Ukraine. So Why this topic is relevant to talk now? Probably you've heard already that more than 60% of people with amputations experience chronic and phantom pain. And other war-related injuries among both military personnel and civilians can also cause similar long-term consequences. Pain management is a complex issue and requires multidisciplinary team of medical specialists. And without proper treatment, patients often mask the pain through continuous use of painkillers, which can lead to addiction. Ukraine currently does not yet have a full established pain management system, but we are working on that together with our partners. What we do, the project includes 4 pillars, 4 directions. The first one is 1 week in-person training and for doctors. And for the moment, we have 60 doctors from different regions of Ukraine who have completed the training. Second pillar is equip Ukrainian hospitals with medical devices used for pain treatment. The third, in addition, we have developed an online learning platform just to provide a wider access to those doctors in regions. And the fourth, we invest in scientific research on pain management and in the development of a digital tool designed to objectively assess a patient's pain level. So I think we are ready to start, and I would like to invite Alexander Shemetun. Sasha, the floor is yours to share about the project and to give a wider perspective on that.
Okay, do you hear me?
Yes, we hear you very good.
Okay, and you can see my slides?
And we can see your slides, yes.
Okay. So, hello everyone. So my name is Alexander Shemetun. Unfortunately, our Vice President of Medical Project, OKSANA could not be here today. So I'll do my best to briefly introduce our initiative to support the pain management system in Ukraine. So I'm volunteer with Know Ukraine and the project lead of this initiative. And so like many others, we intensify our support for Ukraine in 2022. Since then, we have implemented numerous projects and like to highlight just a few of the key ones. So we provide a lot of emergency first aid supplies and first aid training. We deliver critical medical supplies, medication, and different type of medical equipment. We supply hospitals with life-saving medication, diagnostics system, and many kind of different type of medical solutions like orthopedics, fixation device, and many others. So by staying in close contact with hospitals and clinical specialists, we come to understand the true scale of the problem with pain management and realize that we need to move from emergency response to systemic long-term system thinking. So among our activities, we can distinguish between projects aimed at immediate assistance and those focused on sustainable long-term development. One of the most meaningful and impactful example of the latter is the Ukraine Without Pain initiative, whose main ideas and key point I'd like to share with you right now. So, in cooperation with the Ministry of Health of Ukraine, we decided to shift our focus from short-term crisis intervention toward long-term resilience, addressing the most urgent challenge at the systemic level. And I would like to take this opportunity to express my gratitude and appreciation to the Ministry of Health of Ukraine and personally to Vasyl Strelka, to the Ukrainian Society of Regional Anesthesia and Pain Therapy and its president Dmitry DMYTRIIEV, and to the Feofania host clinic represented by ANDRII STROKAN today here, and many other people to their support and active involvement throughout the entire duration of this project. So given the ongoing shortage of resources, we choose to begin step by step prioritizing investment in human capital. So at the first stage of the project, our focus areas includes, first of all, it's organizing on-site training for the pain medicine working group, which include all specialists involved in the treatment and rehabilitation of patients. Since October 2024, we have trained 11 teams from 11 hospitals. So the main idea was to establish pain medical centers or pain medical department based on existing clinics. So second, very important points, developing education courses on pain medicine for all healthcare professionals. This courses was published on our platform, and a lot of clinical specialists already start to do some educations for them. So third one, just 1 week ago, we are launching a rehabilitation specialist training program, and I hope that within 2 weeks we will publish it also online training program with testing for the rehabilitation specialist. Of course, we equip many clinics with essential tools and devices, including cryo and radio frequency ablation system, ultrasound system for navigations, X-ray equipment, and many, many others. So with the Ministry of Health, we're supporting also a working group to develop and implement modern treatment protocol, international standard, and legal frameworks. And very important things to make our activity more evidence-based. We supported also a sociological research that was already been published. We received very interesting result, and maybe ANDRII STROKAN, who led this research, may be able to share more details during the QA session if time allows. So very important thing, it's enabling Ukrainian doctors to participate in international training programs, and we are especially grateful to Yale University and Doctors United for Ukraine for giving Ukrainian physicians the opportunity to gain valuable experience abroad, and I hope that we can share their knowledge and their experience for all Ukrainian specialists. So also we supporting an innovative AI-based project. So it's a development and implementation of AI-based software solution, rapid pain, so-called rapid pain assessment tools. And I think that DMYTRIIEV will speak about this project after. But what is really very important that it clearly shows that Ukraine is not just a battlefield, it's also a remarkable field of opportunity and innovation. So if you would like to learn more or to get involved with this initiative, please visit our project website for more details. And the main idea was to create a platform for cooperation and collaboration aiming to improve pain medicine in Ukraine. So unfortunately, we don't have enough time today to present all our activity and future plans. We are now preparing new initiative in the field of mental health, patient education, public awareness campaign, and many, many others. And it's true that there are many pressing challenges in this area. It's not just well-known Moldbufin syndrome, but many other clinical issues that need attention. And we are deeply grateful to all organizers of this conference for the unique opportunity to share our experience and to connect with like-minded colleagues. And we believe that through joint efforts, step by step, guided by a clear strategy and shared goals, we can make a real difference and bring lasting positive change. So if you are interested in collaboration or partnership, please don't hesitate to reach out. We are open to cooperation and to eager to contact with others who share our vision. So and thank you very much for your attention.
Sasha, thank you so much for sharing. And we continue with, I want to deliver the floor to Dr. ANDRII STROKAN to talk about pain management at Feofania Hospital, building capacity and national standards for war trauma patients. It should be on the screen, the presentation.
I can just, STROKAN. No, it's been working all day.
I think we are ready to continue.
I'm so sorry. Okay. First of all, many thanks for UAMET organization for this brilliant invitation for me. I'm ANDRII STROKAN. I'm a doctor anesthesiologist, a chief clinical medical officer in Feofania hospitals, and I show you how we treat pain and how we change the situation in Ukraine. Me and my family, we live between two questions. Both of these questions is a question from my youngest son. On the 5th day after the full-scale Russian invasion, he asked me one question: why I do have to leave my own house? The second question he asked me, maybe on the second year on this war, he asked me, will I alive until this night? I know the answer for first questions. We really live in Ukraine. We work for our patients. We work for Ukraine. It's our choice. Choice me, my wife, all of the adults. About second questions, I don't have an answer. I prefer do not think about that. It's not only picture, really. Today, after the Russian attack, my hospital stay without electricity for the 6 hours. And my house too. I have a diesel generator. It's some solve of this problem, but it's a huge problem. On the second photo, you can see some part of Iranian drones Shahed, what I found it in my backyard. It's a condition where we live and where we work. I'm sorry for this sensitive context. It's maybe one of the most difficult patients in this war. It's Alexander Bezverny. And our hospital receive most difficult cases from frontline zone. These patients stay in our hospitals for 1 year and 1 month, stay in intensive care unit for 3 months, 5 hemorrhagic shock, 4 septic shocks, 3 months in continuous renal replacement therapy, artificial ventilation, and 125 surgeries, including the plastic surgery. I can show this guy on the last slide. We started to treat patients with military trauma in early 2022. We received biggest medical evacuation in the history of Ukraine. We received 28 intensive care unit patients from Mechnikova Hospital. All of these patients on artificial ventilation, vasopressor supports and others. And for this time, we treated 8,500 patients, half of them inpatients, and only 19 patients passed away. It's not data for sharing, because it's very dangerous to share this data, because Russia attacked the Ukrainian hospitals. What is our main problem? Sorry for sensitive contacts. It's, of course, wounds. What different type of amputation, type of rehabilitation, depression, sleep disorders, and pain. Our hospital concentrated the pain. Why? Because we have a lot of enthusiasts in different departments who works in our hospitals. Our hospital is one of the, maybe the modernest hospitals in Ukraine. And you can see how many specialists you need if you want to treat pain adequately. We have the specialists, and it's very important to treat it for this pain. What is our aims? It's very easy. Achieve pain-free or mild pain stains, not interfering with daily activity or sleep, address insomnia and depression, and most important and most difficult, prevent chronic pain. If you treat acute pain and transition pain adequately, you don't have a chronic pain. The average stage where the patients stay in our hospitals is 39 days. 39 days, patient with military trauma. It's very difficult patient. And of course, enable early reintegration into society or military service. It's a general scheme how we work. I understand it's difficult for understanding, but it's absolutely working scheme. And what we do? A lot of treatment, really a lot of treatment. What is most important in the world, what is famous in the world we use. And many thanks to American company Nevro, who help us. In this year, we performed 4 spinal cord stimulation for patients with military trauma. The Nevro gave us all of the samples free of charge for patients with military trauma, and we have a cadaver course, different type of education, and support of Nevro company. It's American company who localized in New York. And we hope after this meeting, we include some new methods. It's a peripheral nerve stimulation. We have a huge experience, and we propose some new protocol how to treat phantom limb pain and neuropathic pain. We have a 3 edition of our protocol, and I can share you with this protocol. All of Ukrainian hospitals have this protocol how to treat pain with patient with military trauma. And we do not stop. Many thanks for Nova Ukraine support. In this year, we have a very interesting investigation about the pain in patient is military personnel in Ukraine. 30 hospitals, 115 patients for 1 month, and we have a very interesting results. I can share you with our results. We published these results. And most interesting for us, that 20% of our patients take some medicine that not prescribed in Ukrainian hospitals, includes the opiates. We have a huge problem as an nalbuphine. It's some agonist-antagonists, and we have some patients who do not stay in good condition without some prescribing. And education, of course. We started in December 2024. For this time, we're learning 100 doctors from different specialties how to treat pain in patients with military trauma. 10 hospitals. 7 civilian hospitals and 3 military hospitals. For me, it's incredible results. And in last December, some group of enthusiasts based on Feofania hospitals proposed for our Ministry of Health to give some guidelines, Ukrainian guidelines, how to treat pain in patients with military trauma. We have finished on last week, and now our manuscript in our Ministry of Health for assessment. And we think we provide these guidelines for all of Ukrainian hospital and not only Ukrainian hospital. We include all of the important data, how to treat patient from battlefield zone to out-of-patient departments. We have a very good cooperation with different clinics, with different organizations. Many thanks for Mayo Clinic, Yale University, Harvard University, Nevro Company, and ISP, ESRA, ASRA, World Health Organization, a lot of meetings where we share our expertise. And our goals are very simple, future goals. First of all, it's a national approval and implementation of the pain management guidelines, training all cluster hospitals in Ukraine, establishing regional pain treatment center, equipping these centers with support from our Ministry of Health and international sponsors, and sharing our expertise globally, hoping no one else will ever need to apply it in wartime. And acknowledgement, of course, it's all of the international sponsors who help us. And I can show you the Alexander. You show this guy. I show this guy on the second slide. Now he is in Minnesota, in USA, after the rehabilitation period. Many thanks for your attention, and glory to Ukraine.
Andriy, thank you so much for all work you do and for inspiration for, I think, a lot of doctors and patients in Kyiv. I would like to invite our second panelist, Dr. DMYTRIIEV from Vinnitsa, who is online. Dmytro, are you with us? Do you hear us?
Yes, I am here.
Oh, and we hear you so well.
You can see my presentation or not?
Yes, we can see your presentation and we see you. And we hear you.
I can start, yes?
Yes, thank you. Please.
Yeah. Dear colleagues, thank you for inviting me for this very important section about this chronic pain. And we talked about this our initiative was supported is Nova Ukraine. We talked about this AI tools for acute and chronic prognosis in trauma pain patients. It's new initiative because it's our sociological investigation, our sociological publication about this problem. Andrei STROKAN is maybe during his discussion give more information about this sociological investigation. But main problem is the most problems process for treatment is rehabilitation. Pain is a very difficult problem during rehabilitation. Yet we need is found is tools, we need is found is solution how this help our patients during rehabilitation, during assessment pain, and we need is found is very quickly tools how is help doctors is diagnostic assessment of chronic pain. Chronic pain is a huge problem in Ukraine. If you see these slides, we can show this information about these different areas from Ukraine. For example, it's only air attacks areas and only front lines area, and we talked about this chronic pain, this increased level of chronic pain. This patients is on all areas on Ukraine, all zones in Ukraine. If you talk is predictors
I'm
of
so
factors,
sorry. We do not see your. We see your only first slide. So if you are listing, we do not see that on the screen.
I can this.
You just need to make the full screen just to, or just list
I
the
can
slides.
have.
We see your slide, but only the first one.
It's now.
Now we see. Yeah, thank you.
Thank you. If you talk about this chronic pain during Ukraine with different areas, we have this problem with chronic pain. I talked about it. Its main factors of predictions of chronic pain is maybe use a lot of opioid analgesics. Andrei talked about this huge problem is use a lot is nalbuphine. Is we have is maybe, is my opinion, we have is nalbuphine crisis. Because it's a lot injury patients use is opioid analgesic, but we need is found is good solution for assessment pain. And we have why we use this ERPAT. It's new approaches, new method for diagnostic this pain. ERPAT is digital clinical decision support tools designed to rapidly assess and predict chronic pain risk in injured patients. ERPAT is a good IE powered interpretation for pain assessment. Why we use this ERPAT? Is a lot of patients have is after trauma, doctors working is very hard, and we have is limited time. We need is use is good assessment tools, fragment records before start this work, and use a lot analgetics. We have is polypharmacy risk, and we need found is the solution for prevent and diagnostic chronic pain in our patient. What is clinical benefits? Is speed, is to speed for diagnostics is chronic pain, clarity, continuously decision support. Is if you use this IE supported tools, make is good is decision for doctors how we treat your patients, and personalization, because it's now we need is we have is a lot different techniques for treatment chronic pain, but we need is personalization every patient. And new versions of ERPAT. Thank you, Nova Ukraine, for support us with development these tools. But if we talk about not only ERPAT, we use this a lot models. For example, wound assessment system include this wound characteristic, patient information, the sign of infection. But if you use this wound assessment system, we can is diagnostic risk of developing chronic pain. For example, this patient who has this amputation and who has this wound, we demonstrated is indicated approximately 35% of probability of neuropathic pain if you doesn't treat with our special education. We have is in other models is our system. For example, is thoracic pain. It's for example, if you upload a CT scan, we can demonstrate this area of injury, and we can demonstrate it of area with risk of developing chronic pain is our patients, and we can find this good decision, good solution for treat our patients for prevent this chronic pain. Next model is stump pain. For example, this can help us is prevent this stump pain, and good options for make decision how is start when we start this use is protected service placenta. Is for example, is this slide we can show is X-ray images with problem area for its red area for problem area. for developing chronic pain and start this, for example, use prosthesis our patients. As next, MSK, musculoskeletal pain areas. If you upload this ultrasound images, we can show this area with problem. We can found this area with problem. With problem with damage, with injuries with our patients, for example. We have some publication about it. We can learning us information is free. It's Scopus database. And thank you for your attention. If you're interested in this collaboration, we can find this my email. And thank you for Nova Ukraine for support us. And finally, I want to say about we have now approximately 12,000 images who upload this AI system and net AI system for make decisions. It's good options. We continuously developing ourselves. Thank you for your attention. It's glory to you.
Dmytro, thank you so much. And we continue, and I would like to deliver floor to Roman SMOLYNETS to talk more about pain management innovations at the first Lviv Medical Union. Roman.
So thank you so much. It's a great honor for me to be here, and thank you so much for the invitation to speak about such an important topic nowadays as chronic pain, not only chronic pain, but also acute pain. So I will speak about and try to use much of practice experience and like a systemic approach to share our experience how we creating pain management center in the first Lviv Medical Union and also Unbroken. So it will be about key solutions we found, challenges, and lessons learned. So a couple of words about myself. So my name is Roman SMOLYNETS. I am an anesthesiologist and pain management specialist from Lviv, from Ukraine. So I live in the Western Ukraine and work in the Western Ukraine. Currently, I am the head of pain management center and St. Lemon's Hospital, which is the biggest hospital in the consortium of First Lviv Medical Union. Also, I'm Department of Defense partner in case of research and a medical aid coordinator at Support Ukraine Now, the most comprehensive platform how to help Ukraine as a foreigner. So it's important to understand that war accelerates the development of medicine. We all know this. We do a lot of work here. So right now, the first Lviv Medical Union and Unbroken is one of the biggest hospitals in Ukraine, and it's also the biggest evacuation hub from the places of active hostilities. So we receive patients, both categories, civilian category and military category, from all the places of active hostilities. And nowadays, at the structure of the first Lviv Medical Union, there are probably the biggest rehabilitation center called Unbroken. So when we look at about the trauma pathways we locate here in the Western Ukraine, so it's like a third level of evacuation. It's like Walter Reed in the United States when it was the war in Iraq and Afghanistan. There was hospital in Iraq, Lansdale and Walter Reed. So we are at the level of Walter Reed, but sometimes missile strike could strike more than 1,000 kilometers, and we become like the field. Receive patient from the point of injury. That's why it's important, to have this comprehensive approach and systemic approach to manage all different types of patient. And there are three categories of patients in case of military we receive. So there are long patients who come to ICU every Monday and every Friday in the night. So you see this patient is in ICU. He become in ICU for 2, 3, 4 months. Also receive renal replacement therapy, bunch of operation, and it's become obvious to us. It's not our extremity, it's our everyday life, Also another group of patients is patient who comes to the trauma department, to the surgery department. It's a patient with severe wound, severe bone fractures, and so on, highly infected, of course. And the third category of patient is a patient who actually alive after the ICU, or they come from another departments or hospitals, to rehabilitation in Unbroken. So these three domains, in case of pain management, we should approach. So each three group of this patient should have different approach to the management of pain. So this patient with, in ICU and this patient in like a trauma department or surgery department treated completely different. This patient who lost 4 limbs, like, and has stomach pain, has, like another different types of chronic pain, yes? So, and also we receive not only the military patient and like civil, we also receive the children. So we should, like be trained and skill up in the pain management in children. So that's why since 2023, we analyze the situation, and there are main problems and challenges we faced it right now and what we see. So the first and the most obvious is a lack of training. So there is no pain management specialty in Ukraine. There is a big problem because who is responsible for making the diagnosis, doing the treatment, doing the procedures, yeah? So should it be anesthesiologist or neurologist or neurosurgeon? Who should do all of this stuff? I mean, like, it's a huge problem. Here in the United States, I actually come last week from Yale, from Northwestern. Like, people do fellowship for 1 year. They trained with the best specialists 1 year. And this huge problem because we don't have, like, as a specialties. So neurologists, they do their, like, another stuff. Anesthesiology do another stuff. Neurosurgeon do another stuff. And all of them, there is, like, no delegated person who will understand what is actual pain. But pain is like a biopsychosocial model and phenomenon, And this is the first, like challenge. The next challenge is the inadequate level of analgesia during the entire evacuation period of life, period of transition. So on the front line, in the middle of Ukraine, and come to the West, patient receive enormous amounts of opioids. That what mentioned Andriii about nalbuphine or about high doses of pregabalin, which like just too much, and excessive use of opioids is a huge problem. So I will speak about it later. So patients with opioids, they fail all type of treatment. They fail medications, they fail intervention, they fail operations. So next is the limited interventions for chronic pain management. So there is no specialty, and of course there's no people who know how to navigate needle under navigate needle under ultrasound or under fluoro or under CT and so on. The next option is the tailored pain after military trauma. So it's important that pain after military traumas should be treated by multidisciplinary team. I mean, if it be only pain specialist without psychotherapist, without physical therapist, it will not work. So patient will have pain and will have injection, And the absence of research in the field. Okay, so Feofania makes their protocol. Another do something else. Someone do Botox, someone do hydrosection. Is it works? We should do research. We should understand if it's work or it's not work. Yeah, that's important. Because if you do and something get better, you could have cognitive bias, like it's, and our military trauma, they are unique in a lot of cases, That's why important to do research in this area. So, since 2023, we developed the steps, how we should approach systemically chronic pain management center in the first Lviv Medical Union. The first step was, establish the gaps. The second was develop the guidelines, some ground rules for everyone, because hospitals are huge, 3,000 beds. And there should be ground rules for everyone to understand, okay, we deal with this. Patient equates at 6 a.m. here, and we should know what to do with him. Then to create a pain management team, establish the chronic pain management center, establish the research program in pain management, and the most important is like the feedback cycle between clinical operation and research findings. Okay, we don't have fellowship, but we should, accelerate. We should learn and, So what we have right now, we have acute pain service, we have like delegated team, we have ground rules, we have guidelines, we have everyday person, 2-3 persons who come and assess all the patient. We have chronic pain center team, outpatient clinic who works with a lot of our like post-amputation pain, low back pain, headaches. And we have like the research program in pain management. So there are currently 5 research projects together with Department of Defense and including 2 double-blind randomized trials. So since the end of 2023 until right now, we established all of this, 3 bullet points. So in case of research, Stephen Cohen told 20 minutes ago about the Botox injection for post-amputation pain. It was our research, so we do this stuff. So together with Department of Defense, with Aspen Medical, so really grateful for all of this stuff. It's very preliminary data. I mean, I'm still skeptical about a lot of topics in this, but this is a very good starting point. I got it. So, and like New York Post writes also about this. So when we establish the gaps, important to understand that pain is socioeconomic burden. So if you look at like all of this research about the pain, so there are 34,000 people who get evacuated from the Iraq and Afghanistan. And if you look, 76% of this population was not like a battlefield trauma, it's like a chronic pain. It's a burden of war, and so if you have war, everyone has chronic pain. So and meta-analysis indicates I could speak about this like a lot of hours. So a lot of meta-analysis shows that chronic pain is the #1 problem in VA. Like all of the veterans have chronic pain. So that's why it's important to understand some basic stuff. That, okay, pain is a biopsychosocial phenomenon, and the basement is that everyone should know there are like 4 categories of patients who will fail everything, who will fail every type of treatment. There are patients on opioids, patient with obesity, patient with secondary gain, and patient with psychopathological disorders like PTSD. PTSD is a huge risk of fail any type of treatment. Depression is a huge, so if patient has PTSD or depression, he will fail medication, he will fail surgery, he will fail intervention. And the separate factor is the longer period of pain, the worse treatment outcomes. That's the most important part. So, statistics is obvious, so pain after amputation, phantom limb pain, all of the stuff, patient will have this. So in case of establishing the gaps, we organized the mission, so it was hands-on experience in Ukraine from the former head of pain clinic in Cambridge University Hospital, Rokas Tomasauskas. So we established a lot of, like a theory, you might see a lot of people here, we do interventions, we assess the patient, we create actually the mission when we do like a days when we assessing the patient, then do intervention, and everyone will receive, this hands-on experience. It will not work like someone go to the fellowship and, see some procedure and just inject unethically the stuff. No, it should be like the best, learn from the best specialist and, achieve the skills. Second is the development of the guideline. So now in October 2023, I understand that, it's a huge amount of, you should speak the same language with the people. That's why I read all the best practices about, how people in DoD work with this stuff, how they achieve this, solution for the problems. So we established the guideline, we create our goals, we achieve a pain-free, triad, pain, sleep, emotional component, and preventing development of chronic pain. So we create the 6 categories of patient. So each category of patient has another guideline, how to treat them. So in case of this, I create this guideline, but I'm very young, so I actually asked the Chester Buchenmeier, the author of these books and the head of acute pain service in DoD, to ask, and he give me a review of this protocol. He gives the review, so I add this. Then I asked Rokas, the former head of pain clinic in Cambridge, he also give a review. That's why then I asked, Admir Hazik and Stephen Cohen. So I asked the world leaders in this area, okay, should we incorporate this or no? He say, okay, we give some suggestions. To their suggestions, I improve all of this stuff, and right now we use the guideline. So we have delegated acute pain teams. We have every day each doctor from acute pain visits them. We have double check with psychotherapist. So then we create the pain management team. We establish the trainings. We establish the all of the stuff. Establish the chronic pain management center. So there are 3 missions in Ukraine about just for the first procedures and second procedures and third procedures and different diagnoses. We organized probably the most comprehensive, international pain management program, a conference with Stephen Cohen in Lviv, and there was world-known specialists who do all of this stuff. And it's important to establish the research program in the pain, because there are 5 DoD projects, 2 randomized double-blind trials. Another study with Yale, concluding sleep, PTSD with Ilan and with ANDRII Zinchuk. Also, there's a research collaboration is extremely important. And feedback cycle between clinical operation and research findings. So, being here a couple of weeks ago in Yale, in Northwestern, in Charlie Ryan, doing observership in all of these pain clinics, see systemically how the system works is extremely important. And every person from our team actually visit, some cutting-edge knowledge center of excellence. And it's important not only, to have this experience, last slide, but also to learn from the best specialists. this important slide actually. So let's learn. So pain is biopsychosocial phenomenon and it requires multidisciplinary teams. Approach should be systemic, so systemic support patient through the entire period of hospitalization. So is it from ICU or is it from trauma department or is it from like a rehabilitation? So pain management is difficult. It's a cross-disciplinary like a discipline. So anesthesiologists should be trained, or someone else should be trained very well in orthopedics, in neurology, in rehabilitation, in psychiatry, and in case of military patient. And there are so much unethical opportunities. So I actually was, when I was with Stephen Cohen, so he gave me this mentorship, and in Yale they give me mentorship. There are so much unethical opportunities. That's why it's extremely important to, at the beginning, to learn from the best very well, because you could do a lot of, interventions by interventions and it will not work. I mean, if patient has PTSD or if patient has secondary gain, you will just give them injection. It will not work. So you'll use money and, you will use time. So in military patient, this necessity is 3 domains. Proper pain specialists, very well trained, who understand which patient needs injection or not injection or modulation, SCS, something else. Well-trained physical therapists who understand deeply what is really pain, and well-trained psychologists or psychotherapists or psychiatrists, because there are, right now, the spectrum goes to that central part is like an emotional component, more like psycho-emotional component, more than like, just pain, physical. That's why you should have very well-trained psychotherapist. And especially pain management is needed nowadays. It's not could be like, oh, neurosurgeons do injections because patients come to them, because everyone has this herniation, so everyone has this. There should be a specialty who dedicates to this. And the last is the most important, that there should be ecosystem in multidisciplinary hospitals, which will contain the acute pain service, the chronic pain center, and the research program. It's important to understand. So thank you so much. It was a great honor to be here.
That was great. Thank you, Roman, so much. And I would like this round of applause goes to Ukrainian doctors working daily. They are our heroes. And thank you for dedication, your time, and finding this time to reflect and share this experience with this audience. Thank you so much.
Thank you.